This is an official United States public health announcement produced in cooperation with the Center of Disease Control. Due to the increased rates of infection and concerns of bioterrorism, we have decided to inform the public on how to reduce your risk and transmission in public spaces. Please note that this is a serious issue to be concerned about, since most people don't care or realize how they can be a bioterrorist. So, no kissing if you have mono, no coughing if you have a cold, no touching people after using the bathroom if you have hepatitis, no sex in theaters if you're carrying an STD, no scratching your head if you have lice, no exposing your mouth in public if you have SARS, no leaving your house if you have the Ebola virus. Thank you, and always wear a condom, even if you don't want to.
Mr. Stimpy?
I'm his sister, Ashley.
Okay. What's going on with him?
He's been down for the past couple of days, about 3 days. He's been running a high fever. He started that probably yesterday, the day before.
Fever yesterday or the day before?
The day before. And he just hasn't been getting off the couch much. He's just been feeling bad. He's been having, some kind of cold stuff, like runny nose and stuff. But that's about it. He hasn't been eating much either. He's been complaining of his body aching and his back area aching too.
Any headache?
Yes, he's also been having a headache. I told him he has the flu.
Alrighty. Any other symptoms? Vomiting, diarrhea?
No, not right now.
Any trouble urinating or having bowel movements?
No,
something
ma'am.
like that? Okay. Alright. Some vital signs. Temp 101.4. Respiration's 24. O2 sat 94%. Blood pressure looks good. 24/86.
He's been taking Tylenol for his temperature.
When did he last have that?
This morning at 8.
Alrighty, this is the plan. We're gonna draw some blood, do a chest x-ray, and swab him for flu and strep, and we'll go from there. As soon as the room's available, we'll bring him back. Hey Doc, labs are done while he was in the waiting room. Chest x-ray's up if you want to look at that. And he's pretty much ready for dispo, so they're waiting for you.
Okay. Hello, Mr. Stimpy. This is Dr. Brandon. Are you having a little viral symptoms going on today? We think that could be a little flu, touch of the flu. We've seen a lot of that going around. We got your chest x-ray back. The chest x-ray looks clear. You've been running a little fever. I say good fever management. You've been treating it with Tylenol. You can alternate ibuprofen and Tylenol for that. If you have any other symptoms that worsen or anything that comes up that's out of the ordinary that you don't see so far, you can come back and bring him back to us in the next few days if you see anything that isn't corrected. We'll give you some antibiotics to treat and take it home. Make sure you take the full prescription of that, and we'll get Anna back in here, your nurse, to go ahead and discharge you and go over your discharge instructions.
Mr. Stimpy? Hi, I'm Michelle. Anna is busy, the nurse, so I'm going to come in and give you your discharge instructions and explain them to you. The doctor, even though it's a viral infection, we're going to go ahead and he is treating him with some antibiotics anyway. They're broad spectrum. So he wants you to increase the fluids. You can alternate your Tylenol and Motrin every 4 hours. Watch for the fever to go back up. And if it stays for more than a 24-hour period, you need to bring him back. These are the instructions. Just in case you have any questions, you can always call us back.
Okay.
And we will help you out.
Thank you so much.
You're welcome.
Can I have like a doctor?
Stimpy, let's see.
Okay.
Oh, Mr. Stimpy, you're back to see us. Ma'am, I'm gonna need you to stay in here and not leave the room. I'm gonna get the doctor. Okay?
Why you got all that on?
I got a guy in triage that I think might have, call me crazy, but I think he might have smallpox. Can you please go get the doc?
All right.
Need him stat.
Are y'all ready?
Yeah.
Follow me,
Go.
please.
Ma'am, I'm gonna need you to have this mask on.
What's going on? Y'all look like Ghostbusters.
Listen, ma'am, just stay calm.
Well, can you have something for me?
smokes!
We're not here to treat him for pain. He's got a lot of serious complications going on. He does not need something for pain at this time, okay?
Have you seen his face?
I've
It's hurting.
seen it. Okay, just stay calm. Here's what we're gonna do. We're gonna have to get an IV started on him by one of the nurses. This is a very serious case of what is known as smallpox is what we think
What?
it is. Yes, ma'am. Smallpox. So he's gonna have a DFA and a PSR testing for varicella. The specific antigen testing for that for the smallpox vaccination or for the smallpox disease. Do you know if he's had vaccination for that? Have you been out of the country?
I
Has he
just
been
got
out
back.
of the country?
But no, I don't know. He hasn't been out of the country recently.
Okay.
He went to Africa last year.
Oh my goodness. Well, for the last 14 days, have you or him or anybody around him been out of the country?
Yes, I've been on a cruise.
Okay. Well, we're gonna
But
need
this
to test
started
you.
before.
Okay. Well, we're also gonna need to test you.
I mean,
since
we
you've
were
been
here
around him.
14 days ago and y'all didn't do nothing.
Well, let me tell you. This is what we're gonna do right now. I just need you to relax and stay calm. We're gonna test him for smallpox, which I'm sure is gonna come back positive, but we have to run these DFA and the PSR testing for varicella antigen. We're also going to notify the CDC.
Yes, we will be
Notify the
notifying the
CDC.
CDC, yes.
Who else do we call for this?
We need to contact our public health department, the police department. We need to get we call it FBI, because if this is a possible, we're not saying bioterroristic attack, then everybody has to be just prepared.
This is a very serious
I've been on a
case.
cruise. My brother's just been at home sick.
Ma'am,
He's
ma'am,
not a terrorist.
just please calm down. Just please calm down.
Well, I mean,
We don't
I don't
want to have to
understand
call
what's going on
security.
right now.
You need to stay in the room and do not come out.
That's right, Diane. Doctors still appear to be baffled by this new so-called super flu. They're still unsure of exactly how it spreads, and with it reaching near epidemic proportions, the quarantine was enacted and enforced by the National Guard early this morning. Armed troops are not allowing visitors in or letting employees out. As you can see down there, hundreds have gathered at the hospital's entrance, some wanting to see loved ones, but most simply demanding medical attention. Residents are shocked that such a strict quarantine was enacted over something like a flu, with symptoms such as nausea, fever, chills, disorientation, and in extreme cases, reporting catatonic states and delusional aggressive behavior. People have been trying anything for some sort of relief. Drugstores are sold out as of now of a cold medication. There's still no more flu shots available. Hospitals are working well beyond capacity. Doctors still unsure as to what has caused the infection and do not believe it's even related to the flu. Diane, I've now been told this is now a restricted airspace. So we will have to cut our coverage short. God. They're firing into the crowd. It appears they're firing into the crowd.
Okay, we've notified the CDC, the CNO, EMS, the infection control team, the public health department, the police department, and fire department. Also, we've called the local FBI in Houston. We'll need to track the names, job duties for all the staff, the home address, and contact numbers, including home and work telephone, cell phones, and beepers for all hospital and ambulance. First aid, police staff, and visitors who have spent any time with the patient from the moment he or she entered the hospital.
I do believe we have the CDC here already that are recording the patient's progress in the room.
Yes.
Okay.
I'll be taking that lead.
Okay.
As part of the CDC.
Okay.
And we're going to need volunteers to assist with some of these other duties. So I'll need some volunteers from...
I think we have an
Our
all-call.
callback list.
We have an
Our
all-call
callback.
page that we can send out to all the employees in the facility.
Okay.
Mr. Stimpy, we're gonna get some IV started on you. We're gonna get some fluids going. And then the doctor's gonna be back in to talk to y'all.
Hello, hi, I'm Cherie. I'm with the representative with the CDC. I'm going to be filming this process until my crew gets here.
Filming it.
Filming it, yes ma'am. We have to film every step of the process.
My brother is not a science project. He's not going on Facebook or anything like that. I don't think, I mean,
Well,
I didn't
ma'am,
sign any papers for him to be filmed.
Under these circumstances, you don't have to sign a consent. The CDC kind of overrides that. So if you don't mind, ma'am, this won't end up on Facebook or your MySpace, but we do have to film this whole process for your
Where is
protection
this going
and
to go?
to the CDC.
I mean, y'all aren't going to be showing students this at a school or anything?
No, ma'am.
I mean, I don't even know what's going to happen to me. I'm just sitting here with the mask
Ma'am,
on.
if you would just hang tight, you know, we're going to take good care of you, I promise you.
Well, can I get a Coke?
Yes, ma'am. If you'll just hit that call light right there, they'll get you a soda. Hi, like I told you, I'm Cherie. And because you've been exposed to the smallpox, I'm going to have to go ahead and give you a shot for your protection. But just kind of be brave.
What's this for? I don't understand.
It's to help with the
when
smallpox.
am I going to get to go? That's what I need to know.
Ma'am, I hate to tell you, but because you've been exposed to this, you're going to have to stay here in the hospital in another negative pressure room until it is cured.
I'm going to the Longhorn tonight, girl. I got things I got to do.
Ma'am, you will start an epidemic if you go to the Longhorn.
Well, I'm not worried about whatever that epidemic crap is. I got to go.
Ma'am, do you see his face?
Just give me the shot and let me help.
What are you doing? Can I get some help in here? Can I get some help in here? Let me out of here!
You're gonna have to get a vaccination. You're gonna have to get a vaccination.
Ma'am, you've got to calm down, ma'am. Ma'am, you've got to calm down.
Valium.
Sticker. Okay,
Get
sticker.
some Valium. Okay, Mr. Stimpy Dinkle. Here's what we're doing is we're treating you with some electrolytes and fluids just to keep all your electrolytes in balance. And then at this time, we're also going to treat you with the appropriate antibiotics. Your sister is located in the room next to you, which is also a negative pressure room, and she had the vaccination just in case she did inquire this smallpox disease, and we were going to try to keep her from getting as infected as you are. So she'll also be in the hospital. And this disease process, what's going to happen, you'll stay in this negative pressure room until these pustules fall off. Until that time, you will be in here contained and confined to your bed. Come to Jesus,
So I
man.
can wait on the gown.
Are you recording this?
Oh, wait. Somebody pull down the bed.
Yeah, nutsack Sally. Now that's how you give a shot.
Did you see how like?
Was that your butt showing?
Oh